Dr. Brian Dawson is the Chief Medical Officer with South Georgia Medical Center in Valdosta. He currently has 19 confirmed COVID-19 positive cases in his hospital. Dr. Dawson, thank you for joining us tonight. Give us a sense of what you're seeing there.
So what we're seeing in our community, Lowndes County is a community. The county has about 118,000 residents. At this point, we do have about 758 COVID positive patients total. Out of all of those patients, we've only had 4 deaths so far. Although we are seeing this increase in the community, in our hospital, we were running at one point, we're down to about 8 or 9, 10 patients that were in the hospital. And right now we're up to 19. We are seeing the trend in the community for those that are coming back positive. They tend to be younger. About 53% of those patients are between the ages of 18 and 30. And we've noticed that for the inpatients that we're still seeing patients that tend to be older, they have comorbid health conditions. And we're seeing that it's what we had expected before with the younger patients, although they're a much larger number percentage-wise, very few of them are ending up in the hospital. And what we see as one of the capabilities we have as an organization now is that our leadership has been able to get additional capabilities for testing. We have access to testing, which we didn't have before. And with more testing, we've been able to test more patients. And therefore, I think that's why we're seeing, one of the reasons we're seeing an increase in numbers.
We followed the Georgia case study very closely. I mean, is it your opinion that the governor opened too soon and too aggressively?
I think we in Georgia took a very specific approach. It was very measured. I think there was a tiered and step-by-step approach moving forward. I think in retrospect that it was a move that I think was the right move. I can say that the governor in our case was very supportive of the community and helping us to have a hospital that we could use in the case of a surge. And he's done that in several communities for that matter. And in retrospect, I think that there had to be someone that moved first, and I think that was us. And again, we're seeing that the people in our community, by and large, are being very responsible. They're being aware. They're wanting to go out and seek testing like they're supposed to. So we have been pleased in that regard.
I mean, it's still, we're seeing those rising cases. Do you feel, Dr. Dawson, that you have the resources you need in terms of the treatment options, the equipment to deal with these rising numbers?
Yes, ma'am. In regards to our capability as far as our supplies, at this point, we have based on what we had as our previous peak, we have approximately 150. We're able to go up to 150% of our previous peak, and we have enough supplies that will last us out to 6 months. We are able to use the drug remdesivir, which is the antiviral drug that was discussed further by Dr. Gottlieb. That drug, currently we have 7 patients in the hospital that are on that right now. We still do have additional doses that are available that have been provided for us by the state. And we also are in the convalescent plasma treatment trial that we partnered with the Mayo Clinic to be able to offer that to our patients as well.